Back to our top story, COVID cases ticking upward in our state, including the Chicago area. And the head of the CDC now warning this is a pandemic of the unvaccinated.
Dr. Suzanne Bleasdale is an infectious disease physician at U of I Health and joins us now. Dr. Bleasdale, thank you for being here.
Thanks for having me.
So while our daily COVID case counts remain low right now, they are on the rise, as we've been reporting in recent weeks, while the number of vaccinations have apparently slowed down substantially. What are your main concerns right now?
Well, I think we really need those that are hesitant to make sure that you get your questions answered, and we need to get as many people vaccinated as possible. Good data that show that the vaccine is protective even against the Delta variant to prevent hospitalization and death. And so it's really important because the people that are at highest risk right now are those that have not taken advantage of the vaccine yet, and we have ongoing transmission.
Of course, there are children under the age of 12 that can't get the vaccine, but a lot of people are also choosing not to. At a White House briefing this afternoon, health leaders there were saying this really just threatens those not vaccinated at this point. What are you hearing? What are people's concerns about not getting it, and what do you say to them?
Well, I think there's a lot of uncertainty. There's been questions, I think, about early on the speed in which the vaccines came out, but it's been highlighted multiple times that none of the vaccines that are currently available took any shortcuts. And there's been a lot of attention, and the number of people that were involved in clinical trials showed the safety. And then we have follow-up with actually billions worldwide of vaccine delivery that has shown that the vaccines are safe and highly effective in preventing severe infection and death. And so again, we just have to make sure that people understand that, and if they have questions, get their questions answered.
Dr. Bleasdale, the big story of the last couple of days, of course, in LA County. LA reinstating those mask mandates, even for vaccinated people. Are we on the cusp of something like that perhaps happening locally, you think?
Well, I hopefully not, because I think that there is some enjoyment in the opening and the loosening of some of the precautions, and that vaccine does provide some protection. I think the problem is that when we have kind of taken down our masks, there are many people that are not vaccinated that are taking down their mask, and there's ongoing transmission. Those that are vaccinated are not 100% protected, and so I think that maybe with ongoing cases that you want to try to minimize the risk for everyone and try to prevent it being transmitted to others. Really what we need right now here in Illinois and in Chicago is for people that are not vaccinated to continue to mask and keep their distance. And when you are vaccinated, choose wisely when you gather with others that you don't know their vaccination status, and choose wisely when you take your masks down in large settings where you don't know what's the vaccine status of those around you.
You mentioned the vaccines are working even against the Delta variant, but we've been seeing on social media and other places some people got the J&J vaccine, wondering if they need a booster shot since it's not as effective as Pfizer or Moderna. Your thoughts on that?
Well, there's not recommendations yet that you need a booster if you got Johnson & Johnson. There is some evidence that the Johnson & Johnson is protective, although maybe not at the same level. But I think, again, it's not clear that you need another booster if you got Johnson & Johnson, but you may want to, again, be wise when you take your mask down and when you're in large settings that might be a risk for transmission of the virus.
All right, Dr. Susan Bleasdale with U of I Health, thank you for sharing that important message this afternoon. We appreciate it.